Okay, good morning. Last evening, Lewis County received confirmation that we had our first 2 cases of COVID-19 virus. We have with us today the Chairman of our Board of Legislators, Larry Dahlhoff, CEO of Lewis County General Hospital, Jerry Kerr, Chairman of the Board of Managers of Lewis County Health System, I should say, Michael Young, our Director of Public Health, Ashley Waite, and our Director of Fire and Emergency Management, Bob McKenzie. So Larry has a statement on some of the things that the county has been up to, and we will some statements from staff, and then we'll take questions, okay? Go ahead, Larry.
Thank you, Ryan. Good morning, everyone. This news is not a surprise. We've always knew this day would come, and we have prepared accordingly. For the last 3 weeks, key county and hospital leaders have met on a daily basis, and we are fully prepared for the potential expansion of this virus. We have worked with state and local vendors to stock up on personal protective equipment for our first responders and healthcare workers. We have created a detailed plan to expand the hospital's surge capacity. We have cross-trained our employees to assist the public health team with contact tracing and quarantine management. We have distributed masks and hand sanitizer to seniors participating in the county's home-delivered meal program. We are working on expanding this distribution to high-risk individuals throughout Lewis County. The county has also issued guidance for visitors from the New York metropolitan area. We are asking visitors from the New York City, New Jersey, Connecticut, or any other hotspot to call public health upon arrival and self-quarantine for 14 days. These social distancing strategies are critical to keeping our community safe. If you have traveled outside this area, please be a good neighbor and stay home. Additionally, the county is opening a virtual emergency operations center to track additional cases of the virus and coordinate the county's response. Thank you. And with that, I will turn it over to our Public Health Director, Ashley Waite. Thank you.
Thank you, Chairman Dahlhoff. I wanted to start out this morning by giving you an update on our numbers as of this morning. We have 27 individuals under quarantine. We have 2 that are now in isolation. We have tested a total of 73 individuals. 47 of those have come back negative. We have 24 results pending and now have 2 confirmed cases. I will tell you a little bit about our confirmed cases. These patients are in isolation at the hospital. Cases were close contacts of each other, which demonstrates why it's so important to practice personal protective measures and social distancing. Proper precautions were put into place from the start of care for these 2 individuals, so there have been limited exposures. Each known exposure has been contacted and placed in quarantine. Case investigation continues to determine source of infection. There was no travel history, but each case did attend a social gathering within 14 days of symptom onset. Public health staff is looking into this to identify potential exposure source. We can assume community spread at this point. Our early adoption of social distancing measures and weeks of preparation for this response has positively situated us to respond effectively. I would like to encourage all residents to do their part to slow the spread of this virus. Please stay at home and avoid all non-essential contacts with others. Limit trips for groceries, gas, and other essential tasks. If you must go out, stay at least 6 feet away from others at all times. Continue to wash your hands often, cover your coughs and sneezes, disinfect surfaces, and stay informed. Everyone should come together and stay calm. I encourage everyone to stay physically distant but socially connected. I would encourage you all to check on your family, friends, and neighbors by giving them a call during this difficult time. We are very prepared, and I encourage everybody to stay together, and we will get through this together.
Good job, Ash. Bob, come on up.
Thank you. So we all have our own little roles that we fill within the county structure of government. I'm going to be addressing the 911 operations, fire operations, and emergency operations as well. So you may get, when you call 911 for services, regardless of the service, you're going to get questions about possible exposure. Have you been out of the area? Those types of things. That is to keep our responders safe. That's to keep law enforcement, fire, and EMS, especially EMS, safe. Expect to be asked these questions on CO alarms, basement flooding, and law enforcement calls as well. We do have stockpiles to keep our responders safe. We're fortunate enough to have a group that formed back in '08 that was comprised of public health, the hospital, specifically Dr. Herman, and emergency management that addressed similar emergency, and they laid the groundwork that put us in the position that we're in today. So we do have adequate supplies. Utilize EMS appropriately. We've got 10 EMS agencies that service Lewis County. 2 are from Oneida County and 1 is from Jefferson County. They practice appropriate use of PPE on every call. This is something that is not new to them. They've been utilizing the appropriate PPE for years. But they have trained extensively and further on this particular, due to this particular event. Prior to transport, it's important to know that not every single COVID or patient needs to, or suspected COVID, needs to be transported by ambulance. Utilization of the 315-376-9678 number is definitely appropriate for pre-screening prior to requesting transport or transporting yourself to the hospital. If you're having difficulty breathing, chest pain, or exhibiting other symptoms, please call 911 and we will make sure that you do get the services that you need. Our Emergency Operations Center, we are utilizing a virtual EOC. We are utilizing calls, text messages, and email, as well as some other forms of electronic communications. Social distancing is not a new thing to us. We actually drill for this every time that we have a lake effect storm here, because we have to stay home anyway. We've had numerous events within our area that have caused us to stay home for days at a time. 98 ice storm, 07 ice storm. This is not new to us. So I would ask that each and every one of you take advantage of this. You're in your homes with your families. Make memories. This will be that memory that will define that generation. We all have those. Take the time to break out the picture books and show them those snapshots of when you were younger. Laugh and joke about things. Embrace this opportunity to share some time with your children. Call the elderly, check on them frequently. Ryan?
Excellent. So you can see our team here is trying to observe some social distancing. So we're trying to spread out a little bit, but we will take questions, anything that you guys have at this time.
Can Mr. Kerr come up?
Yeah, sure.
What kind of precautions are you taking now at Lewis County General now that you have some confirmed cases?
Nothing is different today than it was yesterday or the day before or the day before. We were an early adopter of CDC guidelines for screening to include taking temperatures. We have been respecting within the organization social distancing. We are an essential service to the county, and as such, every single member of the team is essential, meaning those of us who are not clinicians are expected and would be available to support the clinical teams if our internal cases, our number of patients grows as a result of COVID now being identified in the county.
Do you have any plans of increasing ICU beds or anything like that now because there are confirmed cases?
Not now because there are confirmed. Not now. We developed last week a bed surge capacity, and we've doubled the number of beds, which includes the ICU and medical surgical. We have not been able to double the number of ventilators, but we have learned we may have 1 or 2 ventilators that are appropriate for this splicing. So we actually have a number of staff working on that initiative. We have set up nearly all of our additional beds. So we are licensed for 25, and by Monday, by tomorrow, we will have 50 beds in the hospital appropriate for patients.
How many are ICU?
Right now we have 6. So what we are working through, one of our exercises now is how we could develop a dedicated ICU bed unit. So we're working through that right now.
You mean in addition to the 6?
In addition to the 6, right. But we haven't, really very pragmatically, if we became one of those places that felt some increased activity, all beds would potentially be treated as ICU beds. We can't call it that because the staffing requirements are different if it's an ICU unit versus a medical surgical unit. But we would work hard to meet the needs of any patients who came in, regardless of the bed that they're in.
Are you practicing any more social distancing than normal now that you have some confirmed cases, or is it pretty much status quo?
No, because we were, 3 weeks ago, we started doing that. And, we have limited the number of meetings. We have limited how many people attend those meetings. We have had a significant number of virtual meetings. So those kinds of activities have become part of our normal world. We restricted visitors 2.5 weeks ago, and I think the public has been very understanding and responsive to that. Only 2 doors you can come into our health system now, and after 7 o'clock there's only 1. And if you come in, you're expected to answer screening questions, and we take your temperature. Since we've been doing the temperatures, we've sent nearly a dozen people home. Okay, so I think it's working. The question will be, as we continue to have visitors to Lewis County or seasonal residents, people answering the screening questions honestly. So that will be crucial, because that's helping us manage the current situation.
And also them coming and taking the advice of, if you're coming from New York City, and I'll self-quarantine for 14
Correct.
days.
And call public health so that they can be part of supporting you during this process.
For Mrs. Waite, and I apologize if you touched on some of this in your beginning. We were having some issues with our live stream, so
Okay.
I was working on that. But since this broke last night with the 2 confirmed cases here in Lewis County, obviously we've been getting a ton of questions about various things. So obviously I know with you can't get into too many specifics, but as far as could you give us an age range of the patients, gender, geographic location in the county, anything like that?
I can tell you that they're elderly because we are so small and rural. I cannot give you the geographic location for patient confidentiality reasons.
And can you tell us, people have also asked, if you can describe some of the specific symptoms that these people experience, and if it's similar to what they've been hearing overall in other parts of the country, of the things to look out for, shortness of breath,
They're
cough.
consistent with the 3 major symptoms: cough, fever, shortness of breath.
Okay. And as far as the testing situation locally, I was just wondering if you could talk a little bit about where that's at, how you feel about that. Are you able to get everybody tested that you feel needs to be tested? And also, it was either on Thursday or Friday with the White House coronavirus task force meeting, Dr. Birx had talked about getting into a county by basis to do some surveillance testing and things like that. Is that something you're open to? Do you think that's important here?
So as far as our testing goes, we're doing a wonderful job. When you look at our population numbers, the rate that we're testing, we're right in line with the rest of the state. And anybody who is appropriate for testing, meaning that they have symptoms, they are testing appropriately. We have that capacity. As far as the screening, I'm not exactly sure what you're speaking to.
Like the surveillance testing, where you're going out and more doing random testing and not just testing the people that have.
Yeah, we're not doing that at this point, and I don't have plans to test asymptomatic individuals.
Okay. And as far as the last night, the CDC released some a travel advisory for. It was actually worded as the state of New York, New Jersey, and Connecticut for the unnecessary, non-essential travel outside of your area. So just wondering if you had anything additional to say about that. And I think it works both ways. People coming from the city to up here, but also people in our area kind of keeping close to home as well.
Yep, so our message will remain the same. We're encouraging people to stay home, avoid all non-essential travel, obviously going out and doing the essential tasks, getting groceries and gas, limiting that. But it's important to stay put as much as possible right now to contain the spread of this virus.
And with the 2 cases that you do have confirmed, I know you're doing the contact tracing and things like that at this point. Does it look like there could be a high amount of community exposure with this one? Or?
No, very limited exposure. These individuals were practicing social distancing. So, like I said, we have very few contacts. So.
And you said there's no travel history with them?
There's no travel
But what
history.
about the social event? That you said that they attended together a social event?
So they were not symptomatic. We're looking into that event to see if that is potentially where they were exposed.
Right, but about how many people attended that? Don't know
I
yet.
can't give you that information at this point.
Okay. Sorry, I kind of have a question for Jerry. I don't know. Thank you. In the press release last night, it said that the 2 patients were placed in a negative airflow, and that's about containing any type of virus that's in there. It filters through, not through the rest of the hospital. Is that correct?
That's correct.
Is that capability possible in every room?
No, we have 2 rooms, 4 beds with that capability.
Okay. And will that be as people get diagnosed with a disease? Will that be kind of a first go-to, or?
I would let the physicians determine who is best suited for those rooms. But generally speaking, infectious diseases are placed in those rooms. Typically, it's 1 bed per room, but as part of our search plan, we added a 2nd bed per room. And I've had one person already ask me, well, can we get 3 beds in? There just isn't enough room. But
Right.
So we have 4 beds that have this capacity.
Without that capacity, are other rooms in danger of causing the spread of the virus because of the way the airflow works?
No, it wouldn't be ideal, but we have other rooms that we would be able to organize ourselves to minimize the spread of the virus outside of the room. The most important part of our plan is personal protective equipment. Gowning, the face shields, the masks, the gloves, and there's a specific process before you go in the room and before you leave the room. Hand washing, sanitizing, all those sort of activities.
Will there be some, because as we've spoken about before, there are people who have normal health crises going on at the same time, concurrent, and you're trying to balance the 2 of these things. Is there some way to keep those people that have regular health issues, non-COVID health issues, separate from those with COVID so they don't inadvertently get sick, which may be inevitable, but are you going to?
Yeah, our physical plant is well situated to create, if you will, social distancing among patients who are receiving care and medical surgical. Correct.
Do you know what that plan is yet? Where?
Yeah, it's just separation.
Within each room, but not on different wings, or?
No, it's placement within the wing and creating that distance.
Okay.
Right. But like most hospitals in New York State and elsewhere in the country, we've seen a significant drop of visits since the COVID activity began in earnest 3 weeks ago. So those other issues that would bring people to the hospital, our community members are practicing social distancing and really thinking through, do I need to do this now?
If there is a surge in other parts of the county, are you still considering options of using your other clinics, like in South Louis and in Copenhagen, as triage or places for people to be contained?
No, what we're thinking, Copenhagen, we're still waiting for the department's certificate of need, but we have had conversations, and this is hospital speak. but it puts it into a context, kind of a clean clinic versus a non-clean clinic. And so if our community members need, diabetic checks, blood pressure checks, or are not feeling well but they don't fit this screening or criteria for COVID, we are looking at a plan where they would be at our outlying clinic, so we don't have to bring them into Lowville on the Lewis County Health System campus. So that's a way, from an institutional point of view, we can support and enhance social distancing.
Can you talk about are there any plans that you guys are working on, like regionally with other hospitals? I know the governor talked about it a little bit yesterday, as far as if one hospital is seeing an influx of patients, maybe they can help out other hospitals in the area, that kind of thing. Have you worked with other hospitals in the area to kind of come up with a regional plan?
Over these last 3 weeks, I was kidding Mr. Young that I spend almost all of my day on conference calls.
Me too.
And right, so part of the menu of those conference calls have been regional conference calls. Though we haven't had direct one-on-one conversation with Carthage or River or Samaritan, we have all participated in these regional conference calls. And historically, the hospitals of the North Country do an outstanding job in supporting each other when patients need to be diverted or supported by another institution because the local beds are full. So I'm feeling very optimistic and positive that would continue even with this. However, none of this has surged to a level where that is necessary. In fact, we all have a large number of beds that are open because people are practicing social distancing.
What about the talk of if New York City hospitals get overwhelmed, them shipping patients to different areas of the state?
There was one conference call we were in with some of our leaders in Albany and New York City. Part of what's challenging is when there's a challenge, these calls are doing two things. They're sharing information and a pathway forward. But there's also a part of the call that becomes brainstorming. Okay, let's think out of the box a little bit, and what are the other options? And I think every single meeting I participate in with the hospital leadership, the meetings I participate on these conference calls, there's an element of that. These are the facts for today. This is what we're doing today. This is what we need you, Lewis County Health System, to do today. But then there's that part of, okay, if this grows or a challenge develops midweek, what else can we do? And I think I would encourage the public and our communities not to grab onto that. I truly do believe that we have a moral obligation to help each other and support each other. How we might help the people south of us remains to be seen, but unless we can participate in some brainstorming activities to really evaluate good options, then we're not going to develop the good options. Mm-hmm. So that conversation, that idea was put forward, but I can tell you since that there has been absolutely no indication that patients from downstate would be transported upstate.
I have another question for Ashley. With the public health has been doing a great job, and I know you guys have been very busy over there. My question is, as far as people have seen the guidance come out from the county for people coming into the county from the downstate area and things like that, and then with the new CDC guidance, what is public health doing to, if these people aren't reaching out and contacting you, say a neighbor calls from, their neighbors from New Jersey are at their camp next door or something like that. I mean, are you guys going about it that way too, or are you completely dependent on these guys self-reporting?
We are dependent on them self-reporting. When they do self-report, we're providing the education of exactly what self-quarantine means, and encouraging, if they know of others who are in the area, to let them know of this. So residents that are calling and informing us of individuals, maybe letting their neighbors know that this is something that we've instituted so that they can call us to receive further guidance as to what that self-quarantine means.
Okay, but you guys aren't doing any reach out to people as they're coming into the county or anything like that? You're waiting for them to contact you?
Yes.
Okay. Are there plans to maybe change that in the future, or?
Not at this time.
Okay.
We've had good response with people self-reporting.
Okay.
I can add to that a little bit, Nick. The guidance that we issued on Thursday is exactly that. It's guidance from public health. It is not an executive order. It is not a law in Lewis County. We're asking people to do the right thing, to be good neighbors, and to help us all get through this situation. So we don't have authority necessarily, but as Ashley said, people have been really good so far about calling public health and wanting to participate. So it's
Okay.
been good.
And I guess out of the group here, you're probably the best person suited for this question, but people have also been asking about like the non-essential businesses and kind of what the enforcement is behind that. I guess some people might see something open that they think shouldn't be open. Is that another thing where they just contact public health and public health looks into it, or?
Right now, we are having people contact public health. It is a law enforcement issue. An executive order is a law in New York State. So folks that continue to operate their businesses that perhaps shouldn't, or by law shouldn't, they are risking any licenses or business licenses or whatever else they have from the state of New York. But that would not be up to public health to enforce those, no.
Okay.
All right, a couple more things from us. We do have, as Larry mentioned, we have one wonderful program that's going on right now. We have delivered masks and hand sanitizer to all 210 seniors that are homebound, our homebound seniors that participate in the county's home delivered meal program. We have received 1,000 hand sanitizers from Otis Technologies. They obviously own the St. Lawrence Spirits over in Clayton. That same family, great Lewis County folks, they have provided us with 1,000 hand sanitizing units. Our local church groups and Ashley's daughter and all kinds of people have been sewing like mad. I got my Syracuse University mask, and we are doing our best to distribute these to seniors and other vulnerable folks throughout Lewis County. So hopefully more on that next week. Also, we have, Jenny Jones would make sure that I reminded everybody, we have a great program working with the school districts throughout Lewis County and Lewis County Social Services. We are, basically we have a triage unit of volunteers at the ready. If you need to go to the pharmacy to pick up medicine, if you need to go to the grocery store and pick up some things, if you need any type of errand run or you need some help in your home, we have a list of certified, pre-cleared, fingerprinted volunteers that work for our school districts and the county, ready to go. And all you have to do is call the DSS switchboard, which I have the number here.
376-5400.
376-5400, that is absolutely correct. 376-5400, call the DSS switchboard and just say, hey, I need a little help. I need somebody to help me run to the pharmacy to get my prescription. I don't feel safe leaving the house. I think I have a compromised immune system, or I'm in a high-risk demographic. I would feel more comfortable staying home. Stay home. Let the volunteers that we've lined up provide that service for you. So those are the two programs that the county is working on. And with that, if there's anything else you guys...
Ryan, talk a little bit about when I came in, you said, you were one of the final ones in the state to have a positive test. I mean, talk a little bit about that. Do you think that's the diligence of the county and the programs that were initiated early on?
So yes, Lewis County was one of the last 3 counties that had a positive case reported. As Ashley said, this is not because we weren't testing. We were testing. We've been keeping track of our tests per capita for weeks now. We are right in line with everyone else in the state. I think this has to do with 2 things. One, we really did adopt early in the process some social distancing measures. Our school districts closed Monday. The rest of the state didn't close until Wednesday of 2 weeks ago. Our hospital has been on top of things from day one. And also we have, our population is certainly less dense in Lewis County.
We
I
have
think
built-in social distancing.
yeah. I think I told Nick last week, I think Lewis County's been practicing some form of social distancing for about 150 years. So, I think we're well prepared for something like this. But yeah, I think it's a testament to our community. I think we've taken, the advice from Ashley's team, the advice from the CDC, and the advice from the governor very seriously. And as long as we continue to do so, I think we're going to be just fine.
One other question for you. We did a story a couple days ago about St. Lawrence County reaching out to the Amish. Who, have you guys done anything like that, or are you in the process of doing it? Or
we have a wonderful relationship with the Amish community in Lewis County. When on Sunday, 2 weeks ago, the schools decided that they were going to close, we reached out to the Amish the next morning, and they decided right away to follow suit and close their schools and also suspend religious services. So they have been wonderful partners. We communicate with them through Cornell Cooperative Extension, who has built a great relationship with that community over the years. They're wonderful folks and a big part of the Lewis County community, and they've been right with us from day one. So we're very happy about that. Yeah. Good question.
With school delivery, meal delivery, clearly the closures are going to remain in place longer than anticipated. Will home delivery of meals continue?
For school districts? So 2 meal programs happening right now. One is with school districts. Each school had to submit a plan to the state of New York, and frankly, I think our school districts would have done the right thing regardless of whether New York required it or not. But all 5 school districts in New York State are doing a home delivered meal program for the students. That will continue as long as school is out of session, as far as I know.
It's required.
It's required, so that'll continue. And then our home delivered meal program, last year Lewis County delivered over 60,000 meals to seniors throughout Lewis County. Our enrollment has grown since the COVID-19 social distancing went into place. We've grown the program by over 60 people. So, and I anticipate that program will continue to grow. I think that that's one of the things that I know our legislators feel strongly about, that we want to make sure we continue to have enough resources to support that program, even as some of our other departments are, trimmed back and we send staff home. We're going to continue to deliver meals to the seniors and hopefully anyone else who needs them.
That has been expanded then, not
Yes.
just for seniors, anybody who calls and needs it.
Yes. Not anybody.
Okay.
I think you still have to be in the demographic, but it was always for seniors and those who can't get out, who are Medicaid eligible. We've always had the program available to them. So. Anything else for these guys?
Will we increase testing at this point? We've been kind of waiting for the first cases to see if something would change. Will we try to increase testing, or is it just people come in, they've got the fever, the other symptoms, nothing changes protocol-wise?
Right, it'll all depend on what the public does in regard to presenting with symptoms.
Okay.
Yep.
And any chance of faster response times? Like, I know that I've learned that you can get emergency responses on tests if you really think it's a likely case. There's a 48-hour
So there's,
possibility. Generally, they take 5 days otherwise.
it's called critical specimen transport, and those are for healthcare workers, elderly, or those with underlying health conditions. And those are expedited, and they are getting those results faster. As more labs come on board, more testing capacity is built. Hopefully the test results will come back faster.
Thank you.
You're welcome.
I suppose we should also say this is a public health issue, but also an economic issue, and we should make sure that everybody in the community knows that our economic support office at Social Services is open. It is full staffed. Our economic support and employment office is open. So call down, same number, 376-5400, down to Social Services. They are open, they're staffed. We've got a lot of people working from home. But if you need help with heating through the HEAT program, if you need help getting food through the SNAP program, if you need help, just making through this tough time, paying the bills, we have the temporary assistance program. All those programs are up and running. Social services will be there pretty much no matter what to help the people of this community. So don't be afraid to call if you need some assistance. Employment training as well is open. So.
While you're on the financial topic, I know it's a tough topic when you're dealing with a public health crisis, but can you just talk a little bit about the impacts to the county financials and the hospital financials as far as losing revenues and elective surgeries being canceled and things like that?
So I can speak to the county side. I'll leave the hospital finances to Jerry. About 50% of our revenue comes from two sources: sales tax and state aid. So obviously, I think it's safe to say our sales tax for this month is going to be down a little bit. And if you are reading the tea leaves out of Albany, I think it's safe to say that some of our state aid is going to be down a little bit. So it's too early to say definitively what that's going to look like, but I certainly anticipate, as do most of the counties in New York State, that the 2021 budget year is going to be tough. So we have to get through this year. We have to protect the people. That's a very basic function of government, is to keep everybody safe during a pandemic. We will do that. We will spend what we need to spend right now, and going into next year, we'll have to see what that looks like. So,
thank you.
So we've taken a bit of a hit. Elective surgeries, we stopped, I think it was 2 weeks ago. We've seen a significant decrease in imaging, lab, and visits to primary care and to some of our other ancillary departments. With the good work of many, we've been able to develop some reserves over the years. And so internally, I referred to, we have a rainy day fund. And shortly, we will be going into our rainy day fund. On top of that, we've taken a reduction in Medicaid reimbursement. The insurance companies have become more aggressive, so for the private pay individuals that we serve, or commercial insurance that we serve. So we have some storm clouds in our future. I think at this point, we have put all of our efforts in preparation for this pandemic and for when we finally did see an individual in our institution receiving care with COVID. We've been reassigning staff. We've encouraged what we call, per the bargaining unit contract, to use low census days, and we've activated that. We have not moved to layoffs because we are an essential service, and the ability to redeploy to support the clinical teams is going to be crucial.
Does that include back office staff, Jerry?
Absolutely. Including the CEO. I was part of screening table, taking temperatures and asking people questions on their screening tool. So it is any of us are available to be redeployed to support this public health emergency. Now, we will get through this. We will one day be once again in the future be open for elective surgeries. We will see utilization of our imaging, our lab, our therapies, and those kinds of things will rebound. I also think it's important not to lose track of the future. So we continue to work on the plans associated with our capital project, the revitalization of medical surgical, and the addition of the surgical pavilion and the relocation of our specialty practices. Now, a direct result of this pandemic is there will not be a shovel going in the ground in 2020. We're going to work through the process, and our goal now is to have a shovel in the ground in 2021. So we have to address today. We have to be thinking about next week, next month, 6 months, but we also have to be thinking about next year and the next decade. All of those things are happening. Now, they're happening at different levels of time. It is fair to say 95% of our work right now has been preparation, and now it's focused on it's here. but we still spend a little time each week on what do we got to do for the future, or else our rainy day fund won't sustain us for years. So we're doing okay. The team has been outstanding. We have nurses coming to work every day, doctors coming to work every day, technicians coming to work every day. So the team has been terrific.
Now, when you say reassigning people, do you mean like physically taking people out of buildings, like just for certain jobs, for social distancing, or?
No, our environmental services staff is on the front lines for disinfecting and cleaning rooms, for example. And on the administrative wing, last week, we asked CVS, or Environmental Services, don't worry about us. We have some admin support individuals who are wiping the doorknobs, the light switches, the phones, emptying the trash. So, that's what I'm talking about, reassigning duties and responsibilities so we can support the activity around patient care. We still have to pay people, we still have to pay our vendors, we still have to do all the PM checks to make sure our infrastructure is safe and sound. So, all of those activities. We had to deploy people to build our Call First clinic and set up our triage space, or the space for the hotline, some new traffic patterns into the system. So we redeployed different individuals to do those sorts of activities. So that's what I'm talking about. And how do we decide that? Every morning at 9 o'clock, we have our COVID-19 action team. We have people call in like Bob and Ashley, and then we have our senior leadership come together, strategize for that day, and then we think about what do we need to be thinking about for tomorrow. So it's constant. Several of us were meeting last night with Ashley and Ryan. We all left the hospital at around 10 o'clock last night. I think I found out about the positives at around 6 o'clock, plus or minus. We went into action. We had our chief nursing officer there, our chief operating officer. We had Ashley, we had Ryan, we had myself, so we responded. And shortly, I'll be heading up to the office. I'll be checking in with our chief nursing officer. I'll be checking in with our emergency preparedness director. Every single day, we're evaluating supplies. Where do we stand today? That kind of thing.
I was going to ask you that. How are you set up for PPE and stuff as compared to other places?
I would rank us as on par and online with other North Country hospitals. We can go out about 2 weeks, and working with Bob, working with our emergency preparedness coordinator. We're constantly filling orders. BOCES recently sent us an email, Mr. Todd. A number of the schools in Lewis County donated their personal protective equipment, and it was either delivered Friday or it's being delivered Monday. It's coming right up. So we have an individual working every day on this.
I know a lot
right
of
now we're okay.
I know a lot of local dentists and stuff have been doing that as well.
Right. And I know our chief medical officer for our employed physicians has been working with a couple of organizations locally to put a prototype together for masks and gowns. So we're going to be trialing something. So there's a lot of ingenuity, which is not unusual when you have a crisis, and the best and the brightest rise to the occasion.
Is that also working with some of the local manufacturers like Otis, but I know there's others interested in helping out? Yeah.
Yeah, I can't give you the list of who all the vendors are, but I can tell you that it's being done locally, and locally meaning Lewis County.
Right.
Yes. Okay.
Thank you.
Yeah.
Can I add one more thing? Because I think it would be a shame if we didn't say this. We are one of 2 counties left in New York State that have a county-owned hospital. And at times like this, I think it's important that we remind everybody that this is a hospital that is owned by you, the citizens and taxpayers, supported by the citizens and taxpayers of this county for over 100 years. And we are truly seamless in our operations. And that is because this is a community hospital for the community, by the community, funded by the community. And it's a wonderful testament to Lewis County and the way that we can come together to take care of ourselves. And And I think that's what we need to do right now, just like we have with this hospital for the last 100 years. So it would be a shame if we didn't mention that, but here we go. All right, thanks guys.
Thank you.
Thank you.